What do you think is the main cause of death in the 21st century? It looks like average life expectancy has increased everywhere around the world in the last 50 years, especially in the West. The key factor of this change is undoubtedly the control of infection and infectious disease through antibiotics and vaccines. However, it's not like this everywhere. Controlling infections comes with the rise of antimicrobial resistance and increasing difficulty in preventing infections.
On top of that requirement for global health, one of the major concerns now is that our two approaches to controlling infectious diseases are starting to fall short. You will have heard of the rise of antibiotic resistance in bacteria, the number of multi-drug resistant bacteria which are causing infections and making those infections difficult to treat. You will also have heard of the many diseases for which we do not have vaccines, and of a number of new diseases that we're facing where we haven't had time to develop the vaccines. Of course, we are not without some tools. There are some things that can be done. So the first thing, of course, is recognition of the problem. We have to make people aware that antibiotics have to be used responsibly, and we have to make doctors aware, and we have to make patients aware. We have to change how we deliver antibiotics. This is a picture of a pharmacy in India, and many of you will know that if you want to buy antibiotics over the counter, even drugs of last resource, you can buy them over the counter for pennies in some places. Many of these infections are passed on in hospitals, and we have to do things, and we are already doing things, about preventing these infections in hospitals. And we have to continue looking for new antibiotics to rediscover that pipeline of new drugs. Other things that we can do, and I'd just like to highlight one of the things that we're doing at St. George's, is we're developing new diagnostics. So these are point-of-care diagnostic devices for infections like gonorrhea, where we can do a blood test which will take 10 minutes to give a result, gonorrhea or not, but it will also tell you which drug you should use. So there is no time wasting in prescribing the wrong antibiotic whilst you're waiting for the result of your blood test. What can be done about improving vaccines and getting new vaccines? Well, historically, we've depended on pharmaceutical companies donating vaccines. So they have a market for the product in the developed world, and then they donate excess or a certain number of vaccines to developing countries. That is clearly not a sustainable approach. We've also depended on multi-billionaires like the Bill and Melinda Gates Foundation to donate money to pay for vaccines to put into developing countries. But there is only a limited number of people as rich as Bill Gates. If you read through the literature, you will see that there are a number of developing technologies for new vaccines. We are thinking about things like DNA vaccines, we are thinking about new constructs for vaccines, we're thinking about new ways to deliver vaccines through the skin or through the nose. These are the kinds of new technologies we're interested in. But think about that. None of those are going to solve the problem of infectious disease outbreaks in sub-Saharan Africa or Southeast Asia. They're still too expensive. So in the last few minutes, I would like to introduce you to a completely new approach which we have been working on for the last 25 years. And that is to use plants as an alternative manufacturing approach for developing vaccines. We call this molecular farming. And essentially, we are using recombinant technology or genetically modification of plants to produce the drugs that we need for vaccines or medicines. And my view, and that of many in my field, is that this is an unprecedented opportunity to manufacture medicines to improve global health. I want to give you one example that is carrying on at this moment in Thailand, and that is our project to replace rabies immunoglobulin, a first-line emergency treatment for dog bites in Thailand, with a product of molecular farming. So many of you will know that we cannot vaccinate everybody against rabies, and that we rely on a procedure called post-exposure prophylaxis. Post-exposure prophylaxis means that if you are bitten by a dog you go to the hospital, you have your wound washed, you are given the vaccine, but you are also given rabies immunoglobulin, which gives you the immediate protection over the next 10 days against rabies. The problem with rabies immunoglobulin is it's expensive to produce, and we are limited by our manufacturing capacity. The largest producer of rabies immunoglobulin is the Thai Red Cross, and they use horses to produce serum which contains rabies immunoglobulin. The Thai Red Cross produces about 300,000 vials of this drug a year, which is barely enough to service the needs of Thailand, let alone the needs of whole of Southeast Asia. So our idea, and this is a collaboration with Dr. Bunzerong in Chulalongkorn University, is to produce antibodies against rabies in tobacco plants. We use the tobacco plants because it's a very scalable system. We produce a lot of biomass, and we can produce the antibodies very efficiently. I'm sorry you can't see this data at the bottom, but what it shows is that the rabies antibodies that we have produced in plants so far have recognized every rabies strain or isolate that we have tested in exactly the same way as the rabies immunoglobulin product, which is recommended by the WHO. We're very excited about this approach because we do see it as a cost-effective approach and a scalable approach to producing rabies immunoglobulin for the future. And of course, it can be extended to many other infectious diseases. I come back to the question, how do we maximize our chances of living a long life? Well, I think we have to recognize that the reason we can expect to live a long life at the moment is because we have had a number of medical advances that have eliminated infectious diseases. And I've given you the evidence for that and why I think that is related to the increase in our life expectancy. The first priority is that we need to extend these advances to poor regions of the world. The second priority is that we have to recognize that global medical needs are changing all the time. We are battling antibiotic resistance, we are battling new infectious diseases. We need to invest in new technologies so that we can address the new challenges that medicine is putting up against us. So my belief is that over the next 50 years, the biggest medical challenges that we will face are the continuing battle against antibiotic resistance and to provide modern medicines to all developing countries around the world. And to that, I think investment in science is possibly the most important thing we can do.